So we are live now. Please start, sir.
Okay. Good evening to all. This is Chandra Mohan, orthopedic and sports physiotherapist from Sri Samraj Physiotherapy Center. A warm welcome to all the participants from India and abroad and Fitness and Rehab India YouTube channel subscribers for the EXRX India presenting Sri Samraj Health Services Private Limited's Webinar Super League, an attempt to a world record event, session 27, episode 59, in association with Sri Samraj Physiotherapy Center, Pickle Studio, Physioactive, Sairam Academy, Dusat Creations, powered by Fitness and Rehab India YouTube channel. Today's topic is functional strength and neural component of flexibility in sports training. Will be presented by Dr. Vadivelan Sundaramurthi, PhD research scholar in Tamilnadu Physical Education and Sports University. I welcome EXRX team members Dr. Rupesh and Professor Duna. Now I invite Dr. Vadivelan Sundaramurthi to start our session. Please, sir.
Thank you, sir. Thank you so much. It's a very good evening to one and all. I'm happy to be here. And so my pleasure and my thanks to our organizing team, especially Dr. Chandramohan sir, and my sincere thanks to Dr. Mohana Krishnan from Jibman, who has laid the path for this presentation. Before entering to the topic, I just introduce myself. I'm Vadivelan Sundaramurthi, sports physiotherapist practicing in Kadalur. Let's move on to the topic.
Sir, please share your screen.
Yeah, sure. Is it visible?
Yes, sir.
The today topic is functional strength and the neural component of flexibility in sports training. There is two components in this one. The functional strength training is the one component and the neural component of flexibility. So basically the today topic is strength and flexibility. So what's the different form of strength we can give for this, we can add in the training, and what is the different component of flexibility we can add in the sports training. So there is you can take this topic as a two component. One is the functional strength training, and the second one is the neural component of flexibility. Okay. So I start with a code. A strength in sport should be viewed as the mechanism required to perform a skill, an athletic action. So here the strength is not mean by as a bigger or stronger, nothing like that. Okay. So that's actually usually if you think of strength, actually we think keep repeating the movement and we're getting a bigger muscle mass, and a stronger person would be the strength person. It doesn't mean as a sports strength is not in this way. The sports strength is usually the mechanism required to perform a skills. Actually, that is the mechanism which are required to perform the skills. Or the skills here, the skills is sport specific skills. Okay, here the skills means is the sport specific skills and the athletic action. So whoever going to perform sports with a good strength of especially that skills, that's athletic skills, they consider as a good strength. Okay, here doesn't mean that the strength is a bigger mass or doesn't mean that a stronger person. So before moving on to the topic, actually I just want to give a quick recap about physical fitness and the training principles, because these are the base of the if you take any training, these two components also is very basic. Okay, once you know about the basic well, actually if you recap or if you know the basic well, so you can proceed with your training, and the training must be so effective if you keep on following these principles. Okay, the physical fitness component we can divide it as a two component. One is health related, so another one is skill related. So in the health related, so we have five components. One is the cardiorespiratory fitness, muscle strength, and the muscle endurance, flexibility, body composition. The cardiorespiratory fitness is nothing but it's called a cardiorespiratory endurance. Because the endurance is the ability of the heart and lungs to supply the oxygen to working muscles during the sports activity. So ability. So if you have a good cardiac endurance, that's if you perform a sports activity in a vigorous manner, this function, that's the heart and lung function, will support you throughout the session. Okay, so that's the cardiac endurance. Then coming to the muscle strength. The muscle strength is mean by the maximum force which can be produced by the muscle in a single contraction. Okay, so how much you lift in a single contraction? For example, if you do a biceps curl, so how much weight you are going to lift? So you are handling with your 5 kg or 10 kg or 7.5 kg, how much you are weighting, you are lifting is a muscle, basically a muscle strength. Coming to the muscle endurance, as a muscle endurance is mean by the repetitions. Okay, the repetitions is nothing but the continuous contraction of the muscle over extended period of time without fatigue. Okay, so it is over extended period of time without fatigue as endurance. Usually we take the repetition. The strength is how much weight you can perform, and the endurance is how many repetition. The muscle endurance is how many repetition you can perform do. It's basically it's muscle endurance. Coming to the flexibility is the ability of the body part to move its full range. So that's a flexibility. So the flexibility can be improved by stretching. And the next one is the body composition. The body composition is the ratio between your fat and lean body mass is body composition. These 5 things are health related. So coming to skill related. As skill related, we have a 6 component. One is agility, balance, power, speed, coordination, and reaction time. So the agility is nothing but the athlete how fast he can change his position with control. So you have seen a football. The athlete how fast they are changing their position with control is agility. Okay, and the balance how much you maintain your position within equilibrium as a balance. So we have a static balance. So when the subject is stable, we have a dynamic balance when the subjects keep move on. And the power is doing a strength in an explosive manner. So it's like a boxing. So giving a strength in an explosive manner is considering a power. A speed, ability of the subject who moves from one place to another place. How fast he is moving is speed. And the fifth component is the coordination. The coordination is nothing but integration of body parts. Okay, especially the hand-eye coordination and maybe upper body, lower body coordination. So it's the integration between the body part is the coordination. And the reaction time, how fast the subject is reacting. Okay, the time taken to react for a stimulus. Okay, so for example, if the ball is coming, how fast you are reacting, and how quick you are reacting is the reaction time. Okay, here these 11 components are basic. Okay, so these 11 components is very basic. So you may know the health related. Okay, the health related is the base. Okay, if you have a good base, so the skill related can be achievable very easily. For example, so if you want to train, actually some idea of physical fitness component. Okay, so how could be applied in our practice or in our training? Okay, so if you are training athlete, okay, how can I apply these principles to in my training? So for example, if you're taking any athlete, so if they play football, is the team sports or is the individual sports, this 11 components should be there for athlete. So all athlete, so everyone should have this 11 component. So okay, so where the part of training need. Okay, so it's depend on it's depend on the sports activity. So one is if it is a sprinter, okay, so the proportionate differ in the 11 component. The proposition may differ. For example, if you are training a sprinter, they should have a good cardio respiratory endurance. Okay, so in the health related fitness, so they should have a good cardio respiratory fitness, and the endurance parts needs to be taken care. The second one is the endurance part needs to be taken care. Okay, and the flexibility, then the flexibility comes. If you come to skill related, for the sprinter, the power and the speed is must. Okay, for sprinter, the power and speed is must. Then agility, balance, everything should come. Okay, the proportionate differ due to which force the athlete is participating. For example, again, if you are taking a team sports, you are a football player. Okay, so where I need to focus the training. For example, if it's a football player, they should definitely have a cardiorespiratory endurance. Okay, and the muscle endurance and the power, strength. So these components comes followed by one by one. Okay, so this 11 components should all athletes have this 11 component, but the training differ according to that sports. Okay, The next recap, actually, we know the physical fitness, the 11 component. Actually, what I've said this. So then coming to the principles of sports training. So basically, we have a 7 principles in sports training. So one is individuality, specificity, progression, overload, adaptation, recovery, and reversibility. So individuality. So every athlete is individual. Okay. So you can't treat everyone as the same. So everyone is different. And if you are giving a training to the athlete, okay, so you are giving A as athlete A, athlete B, okay. So you are giving some training, okay, for both same. Actually, they're both getting the same training. A may respond well, okay. The B may not for some training. So if you change the training, the B may respond well, A may not. Okay, I clearly want to say here is, so it's the training is completely should be an individual. You may have a group training, but you should focus the individual training for individual. Okay, so the first principles of the training says the training should be individualized. Okay, and coming to the specificity, the training should be sport specific. So what's mean by sports specific? You should add a training. Actually, you have to form a training. It's the activity which mimic or which resembles the sports. What the athletes participation in the sports. Okay, so the training should be most of the time should be focusing the athlete sports. The stress applied. So whatever the stress applied during the training, the body must be same as chosen sports. Okay, that's is the specificity. And coming to progression. Okay, so progression. So progression is, you have the athlete needs to be progressed from one level to another level. Okay. The progression should be slowly, gradually increase the workload. So for example, you are walking 2 kilometers today. So and you are going 5 kilometers tomorrow, and then again 10 kilometers, definitely you may straining your body. So this is not a right way of training. The training should be slowly and gradually. So then the load, the accept that you are training, you are making adaptation that's gradually building a overload to the body. The body will accept the overload. Then the fourth one is the overload. So overload is nothing but you are giving some extra load, additional stress. Okay. So you are giving additional stress to the body. So this stress will give a long-term adaptation. So long-term adaptation, that long-term adaptation will produce a higher level of performance. So how you make the athlete how you get the athlete higher level of performance? This goes giving an overload as a periodical slowly, and that will make the athlete give a higher to athlete to perform in a higher level. And the fifth one is your adaptation. Over the time of body become accustomed. Actually, whatever the training you are giving to the athlete, so sometimes the so during over the time the body is getting adapted for the training. Okay, so adaptation is, so if you're giving a same intensity of workout for over time, that will not going to help the athlete. Okay, so the training should be given. So as I told, it should be overloaded. So keep in mind the body is give adaptation over time. So the 2 kilometers walk every day is not going to help the athlete, because one stage the athlete is getting adapted for that training. So the training should be changed over time. Okay, that's the principles of adaptation. And the recovery. So recovery, the rest is the must one. So recovery says the rest is the must one. Can't repair itself without rest and time to recover. Athlete can't repair itself without rest. Even the muscle can't repair itself without rest and time to recover. So between the sets or between the period, so the athlete should get to recover. So the rest is the must one for the athlete. So that's the sixth principle. And seventh, reversibility. So for example, you're training athlete for the 3 months or 6 months, the athlete is trained well. Okay. So he is trained well and he is not going because of some issues, and his lack of training for another 10 to 15 days. So what will happen? Slowly deprive. So as the athlete power is going to come down. So the training should be all the time. So maybe the rest is the must one, but you should not lose your training for the long time. That will make a reversibility, because the muscle power is going slowly down and it's getting down or reduced. So here the seventh principle says the training should give to the athlete over the time, every time. So with proper rest. So these are the 7 principles. Okay. So why are you knowing this? Actually, what the need of knowing these principles? So how I'm going to apply this principle to this? So if you're training athlete, okay, if you're training athlete, or if you're treating a patient, okay, for example, we all the physiotherapists, we treat a patients, okay. So every patient is individual, every athlete is individual. So you have to choose the exercise according to the patient need, an athlete need. Okay. For example, if the back pain is coming, okay, if the back pain patient is coming to you, and you may ask the patient to walk 2 kilometers in a day. At the same time, the specificity principles say treat the back, treat, give some exercise for back. That's the specificity principle. The progression says don't give a same exercise. So teaching exercise, sometimes so leading the patient, again, you will not get the response. The progression says progress the patient slowly, step by step. That's the progression principle. Same in sports training. And overload, additional stress, okay? Give some weight training or resistance, simple resistance or self-resistance. So those things needs to be applied for the patient, the principles of overload. Same things apply for athletes. An adaptation, the patient may get adaptive for your exercise. The exercise needs to be reviewed in a periodical way. So that's the principles of adaptation. The same thing applying for your athlete. Okay. The recovery. So if you're giving a repetition sets of exercise, don't give a too much exercise for the patient. The rest is the must one. So give a proper rest in between the rest. The same thing again for your athletes. And reversibility. So the exercise needs to be continued certain part of time until it doesn't happen. So 1 day or 2 day or maybe a week will not going to help the effort. At least so says actually the literature says minimum 6 weeks needed for the exercise for the patient. So the patient may lose if they, the benefits if he is following 1 week or 10 days. The exercise needs to be continued at least 6 to 8 weeks. The same thing, the athlete needs to continue all this training throughout us on time. So that what the performance in this sports, throughout the performance of sports. So actually we talked about the overload. Actually the overload, how you are going to apply this is overload. We have a four things actually in the focusing overload. Frequency, intensity, time, type. Okay. The frequency. So how many days in a week athlete is going to do a training? And the intensity, again, it's the amount of load, how much load the athlete is going to handle, speaking of intensity. And the time, the repetition. A repetition is as action of 1 repetition. So the sets is, so how much repetition the athlete can perform without rest is the repetition. For example, so if I have my first set, I'm doing a biceps curl for 15 repetitions. Okay, that's my first set. Again, I'm taking some rest. And again, I'm doing a 12 repetition. That's my second set. And third one, 10 repetition. So that's the third set. The sets mean that, so the repetition is how many repetition I can do without rest is sets. So usually the strength training, so we actually strength training, as the ratio says, the 3 to 4 sets is needed to form a strength. Okay. And the type, the mode of exercise performed. So what the mode of actually we may have a different type of exercise. For example, so dumbbells curl, a curl bar. So if the same for same muscle, for example, same action, you may do the same strength exercise in a different way. That's mean by type. Okay. So again, how I am going to apply this principle? So frequency means how many days the athlete is performing in a week. Intensity, how much weight. So intensity here is how much is load. The same time intensity is the time those things will come, and the time how many the repetition and sets. So the volume is the repetition and sets, and the type is which type of exercise I'm going to perform for the athlete. So I'm going to give for the athlete. So types of strength. Okay. So we have a three type of strength. One is the absolute strength and relative strength and functional strength. The absolute strength is greatest amount of weight an athlete can lift. Okay. So in a single time, how much weight I'm going to lift is a absolute strength. And the relative strength, athlete absolutely, so my absolute strength divided by my body weight. Okay, so the first one are the weightlifting sports. Actually, the athlete performing weightlifting force can add it in this criteria. So for the example, deadlifter can come in this criteria. The relative strength is absolute strength divided by a body weight. For example, strength actually below under 50 kg, under 60 kg performance, under 70 kg performance. So those things will come under the relative strength. Then our topic is the functional strength. So the functional strength is the mean, is the amount of strength an athlete can use on the field. Okay, so whatever strength I'm having in my gym, whatever strength I'm having in my weight room, it doesn't matter. Okay, so I'm lifting 100 pounds or 200 pounds, it doesn't matter. Okay, that strength needs to be converted, whether it can be convertible to the sports action. It's a functional strength. So as I say, the functional is it should be a functional one, the strength training. So adding some strength to the functional component is a functional strength training. A goal of good strength training program should not be developing great success in the weight room. So as I said, the great goal of our strength training, actually it's not about developing a great success in the weight room. It should be about transferring the gain. Whatever you gain in the weight room or gym, it should be developed to the gains. It needs to be transferred to the athletic performance. So that's the great success of our training. So performing a good weightlifting in the weight room, it doesn't going to help the athletes in the performance. So the coming to the topic as the introductions, we have finished the recaps. Now the introduction. So what's mean, actually, I said what's mean by functional strength training. So here I just want to imply some principles and some codes. So supports functional strength training. So the muscle isolation exercise, whatever we do, so as a biceps curl, strike curl, as a chest press, whatever we do, is a primary goal. Is not a primary goal for an athlete, as we already talked. And the set principles is nothing but a specificity adaptation to imposed demand. Specific adaptation to imposed demand. So whatever you train, you get that. Okay. If you train an athlete for endurance, definitely the athlete is going to perform the endurance activity in a well executed manner. If you train an athlete for strength, you'll get the same. So the set principle says the body will specifically adapt to the type of demand you placed on it. Okay, the body get adapt. If you are giving an endurance workout, definitely the athlete is going to performing. You are increasing performance on the endurance. So this principle says the body will specifically adapt to the type of the demand you placed on it. So isolated movement not necessarily transfers any benefits to the functional movement. Why the isolated movement is not benefits? Because it's looking as a muscle. Okay, the individual muscle, you are doing an activity for an individual, but the sports is not an individual muscle. Okay, there is the larger muscle. It's completely a pattern of movement. Okay, so a pattern of fundamental movement. So if you are training an individual muscle and you are executing as a sports performance, definitely it's not going to be helpful. Okay, this principle says the same. And the fundamental movement skills and movement literacy is trained. Once you train the fundamental movement skills and movement literacy is trained, high transfers of benefits. There is a high transfers of benefit to enhance sports performance. So if you're not training a fundamental movement, if you're training an individual movement, there is no transferable those training to the those training into a performance. Okay, here this principle mainly says is the fundamental movement skills and movement literacy is trained, high transfers of benefits to enhance the sports performance, and mainly injury prevention. All the athlete need injury prevention. Okay, so the injury prevention is the main things every athlete needs. So this can be achievable in functional strength training. So again, bigger is not necessarily better. Okay, so building a strength and giving a bigger body is not necessarily a better. Don't build strength on the top of dysfunction. Okay, so if you are keeping a dysfunction, you are making an athlete very less flexibility with isolated training. Definitely, we are build a strength on the top of dysfunction. And the strongest athlete weight room is rarely best athlete on the field. So who is stronger in the weight room is not basically will perform the same action in the athlete field. And the thing, actually, as I told you, the brain always they never think as an individual muscle. It's think as a movement pattern. So training athlete by individual muscle is in the brain. You may lack of neuromuscular coordination. So training athlete, the term of movement, definitely you'll get a good neuromuscular coordination. So that's is the basic of support performance. Okay, the sports training is important to restore the neuromuscular. As I told you, the sports training is important to restore the neuromuscular control and preventing recurrent injury. So finally, so what's the difference? The traditional strength training and the functional training, strength training, what would be the different? So in the traditional strength training, what previously they followed is actually we may train the agonist, that's a prime mover. The quad become more developed as a prime mover. Okay, it's getting stronger. So what about the small muscle? Small muscle here I meant to say are stabilizers. Okay. So if the quad performs, the quad should perform in a well-executed manner, the quad needs to be stabilized somewhere. Okay. If the stabilizers are weak, so this action, however strength this quad may have, so this will not execute it, but because it's not stabilized properly. So here the strength and isolated training or traditional strength training method, just we are lacking strength, especially for the small muscle, which stabilizing the larger muscle during the movement. Okay, the functional training is not actually here as a functional assistant, is a thinking of movement definitely is going to be help for the stabilizer as well as the prime mover. So this, then what's the need of functional strength training in the sports? Okay, so why it's needed? So here I have almost 6-7 components to say why it's needed in sports training. The first one is, so shall we proceed with the slide? So the first one is the multi-directional movement. The functional strength training, we get a multi-directional movement. As I said, as isolated muscles, I work as a uniplanar. So I have given an example as a bicep curl. So we know this, all these three planes, sagittal and coronal and transverse plane. So running, okay. So running, we think our body moves as in one direction. Definitely, it's not. Okay, our body is a term of movement, is a term of plane. So our body is performing in the three planes. Okay, so one is the sagittal plane movement. The leg and arms move. Okay, in the sagittal plane. Okay, and the frontal plane, our pelvis. Okay, our pelvis moves along sides. So this is in frontal plane. And our shoulders, okay, and the shoulder head moves in the transverse plane. Okay, if you look the running, so it's a three-plane movement. Okay, for example, if you want to improve running, giving a leg curl or leg extension in a uniplanar, whether it's going to be help the sprinters, definitely it not, because so when you move your legs, the body, the cores, okay, the core, the pelvis, and your shoulders need to give a stabilizing action for your running. So if it is not stabilized properly, definitely whatever the power the lower limb has is not going to be executed. Okay. So this can be achievable. The triplanar movement can be achievable in functional strength training. So enhancing stability. So what's mean by stability? Stability is when some part of the body move in one direction, okay, the part of body move in one direction, the other part needs to hold fast, okay, and hold fast and resist the motion. Okay, your body is moving in one direction, the remaining part of the body, so try to hold it fast and act it fast and resist the motion. Okay, this is the stability. For example, again, I'm taking an example of running. So you can see the left side. So the runner. So when you move your legs, okay, or keep moving your legs will make you run fast. Okay, so front and back will make you run fast. So and the pelvis is going to stabilize your movement while running. Okay, but think there is the gluteus medius weakness. This is a hip abductor. Hip abductor. There is a weakness of gluteus medius. So what would actually, as the right side, there is the gluteus medius, okay, weakness. So definitely the left side hip going to be dropped because this has lack of control. So this has this side, the right side has a lack of control. So automatically it's not going to stabilize while running. So the left side is going to drop. So because of the gluteus muscle weakness. Okay, so what would happen if I run? Okay, there is a lack of stabilization. However, strength I have in the lower extremity, I'm moving forward, but this stabilizer is not working properly, so I can't run fast. I can't run fast because lack of stabilization. Even I have more power in my legs. So this can be enhanced by the functional strength training. Same thing, actually, we see the throwing action, okay? So we love cricket. We love watching cricket and we love playing cricket, okay? So you may have seen a fielder throwing a ball, okay? So have you ever watched the fielder is running, and stays stable for a second and they get a throw? Okay, so they are not throwing while running. Okay, so they run and stable 1 second stable and they throw. So that stability is that is the stability. So you have to stable when you perform a power action. So then only the power you can execute properly. So that's the thing, is enhancing stability. The enhancing stability can be achievable through functional strength training. And the neuromuscular enrichment. Okay, the traditional strength training, as I told, is the one directional movement of the brain muscles actions, so one directional movement. The functional strength training is the multi-directional. The two-way communication is the best on the functional strength training. Okay, the brain to the body to the brain is the two-way communication is the best on the functional strength training. So weight loss force, weight gain may create advantages. For the weight loss, weight gains. Actually, the athlete is gaining weight and muscle mass. Okay, the weight loss force. Okay, actually, I have bigger. Actually, I have stronger. I gain muscle, so that's okay. For think as a team sports like a football. Okay, so weight gain may affect the athletes. So the weight should not gain through training. Okay, so the weight gain may affect the athletes. So here, the strength needs at the same time, strength also needs to get improved. So that the functional training plays roles. So without weight gain, the functional training can help the athlete to get a strength. And the next point, less stress on the muscle. Okay, so if you're giving a workout, more workout for an individual muscle, there might be a conditions, there might be a chances of fatigue. But if you are giving training in a movement pattern, so that might be the individual muscle fatigue can be avoidable. So triathlon, actually, usually the horse is the term used for a swimmer, riding bicycle, and runner. Okay, triathlon. Actually, they more focus on strength. Usually, they more focus on strength. So usually they more focus on endurance. Okay, so for the athletes, giving an only giving an endurance program is not going to help. However, they need endurance. Only treating endurance is not going to be help. So it's actually it's a kind of a three-way stimulation. Actually, this kind of athletes need. Hello. Hello.
Hello.
You can continue, sir.
Sir, any disturbance?
Yes, sir. We removed him. No problem. So you continue.
Okay, sir. So here, actually, the endurance athletes need not only the endurance, actually they need a strength and speed. So once you try these three triangle, the performance, so these three component, the performance is going to be improved. So if you are strength, actually, if you are an endurance athlete, so endurance training is not only going to help you. At the same time, you have to look other component. As I said before, you have to look other component. Maybe the endurance may have a larger proportion, but the muscle strength and aerobic have a very less, not very less. And the next component would be the muscle strength and power. If you train endurance, these all three component, this or whatever the benefits, the athlete will persist for the long time. Longevity in sports. Okay, we all know by aging, our strength and endurance decline. Okay, the study says a peak strength in the early, so we may have a peak strength in the early to mid 20s. The 20 years of age, our strength is peak, and it decreases a rate of 1% per year. Okay, it's decreasing 1% per year every year. We lose almost a 10% in per decade. So we lose our strength 10% per decade. So why this needed here? Okay, so individuals who maintain a lifestyle vigorous activity. like athlete, okay, individual who maintain a lifestyle of vigorous activity hold on their athletic capability for longer and deteriorate more slowly. A study says, okay, so whoever having a vigorous activity, they can hold their athletic capacity for a long time and deteriorate more slowly. A functional strength, a slow loss of aerobic capacity actually is allow you to slow loss of, is not in this way. Actually, every year you may lose 1%, is not going to allow you to lose 1%. It may slow down the loss of aerobic capacity. And by how? By optimizing muscularity, minimizing fat storage, okay, is minimizing the fat storage in your body and reducing the rate of injury. In this three-way, the functional strength training going to help your deterioration slowly, not as I said, 1% per year. Proprioceptive feedback. Okay, how it's help to proprioceptive feedback? As I told you, the runners need to do a leg curl. Actually, I give an example of leg curl, sitting leg curl. You know, actually, what's mean by proprioception? The language of the nervous system used to figure out what's happening in the body. Okay, as a language of nervous system used to figure out what's happening in your body and what to make a move next. Okay, what's the next movement is decided by the proprioception. Okay, so if you're giving a workout like a leg extension, a sitting position, how much proprioception you are engaging? That's again a question mark. Okay, your body is well seated, and there is actually with the comfort zone, and it's only the muscle action is performing. So where is the point of proprioception? Okay, the same training is in a way of lunges. Okay, lunges. So if you're giving lunges, actually here. Here, actually, I want to just quote this point, okay? Just remember this point. When the training, I just repeat this one, you may wonder how much the functional training is going to help the athlete, okay? This is the point. In the lunges, actually, we are teaching the hamstring. This is the hamstring. We are teaching the hamstring to extend the hip while controlling the knee flexion, okay? So just, I repeat once again, we are teaching the hamstring to extend. As we know, actually the hamstring is mainly prime mover of knee flexion, okay, and is also assists hip extension, okay. So this word, don't forget this one. So you may wonder one. So actually, I give an example, and I give an athletic action. How the functional training is going to athletic action. So keep remembering this word, okay. Teaching hamstring. The lunges will teaching the hamstring to extend the hip while controlling the knee flexion. Okay, so you think this is the action is same for the hamstring training. So how much your body need a proprioception, okay, while controlling your body in a front leg, okay, and you are treating your back hamstring and while controlling both component, okay. So upper body is well stabilized, so stability component is okay, and the mobility lower body is you are giving a mobility component. The same muscle can be trained while training in functional training, okay. So it's required the body to develop in order to execute movement correctly. So this is the proprioception feedback. So what's the next advantage in functional training? There is a little space wherever you can want. You can keep as a functional training. So even you can make it on the parking lot. Even some small accessory is more than enough. So there is no such a big missions or needed in this one. So very little space, little equipment, and little time. That's all about the need, okay. And the myth about the functional strength training, okay. So we will know, we have seen many athletes has been trained on the balancing board, Basel ball, and the stability ball, that is the Swiss ball. So we have seen many athletes treating over the unstable surface, okay. There is always a controversy, okay. Treating athlete on the floor is better, or treating athlete on the stability ball is better, okay. So here I have two things actually. I just before going this actually, we have a definition of what is mean by stability and what is mean by balance. Okay, the stability is, as I told you, is a control of unwanted motion to restore the maintain a position. Okay, so if you want, actually, I have given a throwing action. So it's a control of unwanted motion to restore the maintain the position. Okay, that's a stability. The balance is acts of manipulating a opposition force to create a stable over the base. Okay, actually, I have to balance myself to stable straight over the base. Okay, that's the balance. So stability requires a transfer of high forces to create rigidity. Okay, so if you actually, it requires a transfer of high forces to create. Actually, when you throw in, the body is rigid, and then only I can transfer the force in my hands. Okay, in coming to the balance, required a transfer of low force, maintain the equilibrium. This is a low force to maintain the equilibrium. Okay, here I have given two triangles. So one is the triangle is kept on its base. Okay, so this is the red one, the triangle is kept on its tip. Okay, so think this is the athlete. Okay, the many force are acting over the athlete. Okay, so many force acting over the athlete. So do you think of which triangle would be more stable? So which triangle may observe more forces, whether the balanced, whether which triangle is based on in its base or in tip. Definitely, the triangle which placed on its base is going to observe more forces. Okay, so whatever forces you are giving, so definitely it's going to observe. It takes and it may act according to the force. But the tip one, okay, the tip one, so may withstand for minimal force. Okay, but so if we keep repeating from the various direction, definitely this one is not going to withstand. This is the balanced one. This is the stable one. Okay, so athlete would be a stable position to, or to say, to accept all his forces. Okay, the athlete should be trained in a stable position. Actually, I may accept there is a balancing ball will increase your proprioception. Yes, this is the kind of proprioceptive training. Okay, so athletic train, most of the training, actually most of the load training, strength training should be kept in a balanced one. Okay, this is a stable surface instead of keeping it on the unstable surface, because the stable surface observe more forces when compared to unstable surface. So here the one point I want to say, actually, so the most of the athlete moves, actually, if you take all the sports activity, there is no surfaces move in the athletic for sports activity. So surfaces stable, okay? The athlete move over the stable surface. The surface is not moving. Stable, okay? The athletes move, the playing surface, all the sports, only the athletes moves and the playing surface is stable. Okay, so we have to train the athlete, so most of our training should focus on the stable surface. So that's all about the need and might of functional training. The next subcategory is the functional movement screen, how you can screen the functional movement. There is no quantitative assessment for functional movement screening. Okay, it's a predictive assessment. Okay, it's a predictive assessment. It's a diagnostic tool. Okay, so you can use it athlete as well as the normal person to test the balance and coordination. These 7 testers can be used. So these tests is composed of 7 fundamental movement pattern. Okay, that requires balance, mobility, and stability for successful completion. So one is the deep squat, hurdle step, and inline lunges, shoulder mobility test, active straight leg rising, and trunk stability push-up, and rotatory stability. So how the scoring system? Actually, we have a 3 points ordinal scoring system. 1, 0 is if the athlete saying in these 7 tests, if the athlete saying pain, actually I'm not able to do because of pain, this is 0. So we will give a 0. The person is unable to complete the movement pattern. Okay, he is not able to complete the movement pattern. The score is 1. Okay, the person is able to complete, but with compensation. Okay, something is compensation movement, and the score is 2. The athlete can complete the movement with proper position. The score is 3. There is a 3 points for start 4 point scale. Start with 0. The 0 is if the athlete is not able to perform because of pain. 1 is not able to complete the movement. The 2 is complete with compensation, and 3 is complete perfectly. So deep squat. Okay, what's actually deep? What the deep squat assess? Okay, it assess bilateral symmetric mobility and stability of the hip, knee, ankle, and core. Okay. So squat actually, I just want to mention here, so that's just away from the topic. Squat is a very functional movement in Indian culture. Okay. So we all as Indians, so the squat is one of the very common functional movement in our daily life. But if I ask you if I ask you one of them to squat, actually it's definitely they may have a difficulty in squat. Actually, the very less actually members can squat perfectly. Why this is actually we are not using actually once we are changing our toileting to Western culture, then actually we have a loose squat. Okay, so once you anything actually the body flexibility, if you stop doing that activity, definitely the flexibility you are going to lose. Okay, so once you lose the flexibility, definitely it's not going to come. Actually, you are not squatting for a long time, and if you squat in a single day, definitely it's not going to come back. So you have to train it for it. Same thing, actually. It's a bending action, a squatting action, it's a lifting action, everything. So especially in Indian culture, squat is very one of the functional activity for everyone, but we may lose changing the toileting or as floor sitting. So we actually, the Indian culture, usually we have our uh, dinner or lunches with the floor sitting. Okay. So once we lose all this one, so the squat is a very tough for everyone, and it's become a trained activity. It's not a functional one. Okay, coming to the topic. So what's the deep squat assist? Okay, actually I have given the some points here. Okay, so the points here, one is on your hand, the knee and hip, shoulder, and over the hand. Okay, so here, so what is the perfect squat? The squat is, this should not, when you squat, the foot should be flat. Okay, the foot should be, the first thing is should note, the foot should be flat, and the knee should not cross your foot line. So here you can see the foot line. Actually, I was just showing with a stick. Actually, the knee should not cross your foot line, and this position is knee dominant position. What's mean by knee dominant position? Your knee is dominant than your hip. Okay, so your knee is the dominant one than your hip. So this is the one needs to be noted, and your back usually should be straight. Okay, if it is straight, then only you can load your glute. And your hand, this bar should not cross your feet. Okay, this bar should not cross your feet. This is the perfect squat. Okay, so how I can score? This action is not able to perform because of pain is at 0. The screening activity, actually I'm just mentioning on the screening activity, this action is not able to perform as a 0 because of pain, 0. If it is not able to complete is 1. They are completing with a compensation, maybe 2. If they're doing a perfect squat, they scored as 3. The next screening is a hurdle step. Okay, the hurdle step here, the height of the step is the height the athlete should cross is about tibial tubercle. This is from ground to tibial tubercle. Actually, we've just measured this height from the foot to tibial tubercle. Then we place this stick. Okay, so if once it's placed, athlete needs to take a step forward, and once a step forward, the athlete needs to place his heel, not complete foot. The athlete should place his heel, and once he's placed the heel, and here after that, he or she has to go back to starting position without losing his balance. Okay, this is hurdle step screening. So what is measured is challenge the ability to stride. Okay, is challenge the ability to stride of the athlete and balance performance in a single stance during. Okay, so most of the time, so athletes in the many sports action, the single limb balance is very important. Okay, so you should be stable with your single limb while you have performed some sports activity. If you are kicking a ball with one leg, this leg should be stable. Okay, this is this test assess the mainly single leg balance. Inline lunges. Again, this lunge distance is measured by from your foot to your tibial tubercle. This length. Okay, and the athlete has to make a lunges. and the rod has been kept over his back to maintain a stable back as a proper back. Okay, so this is not an easy position to achieve because the many of the athletes lean forward, and the stability of the knee may affect, or the mobility of stability of the hip, or mobility of the hip or stability of the knee may affect during the lunges. Most of the athletes never take a load over the back. Most of the actually, if they have a weak stabilizer, they may lean forward. Okay, so what it does is, again, the inline lunges, what it does is it stimulates a dynamic deceleration with balance. It's balance and lateral changes, especially lateral changes can be assessed with inline lunges. This is the third test. Again, I have given a scoring system, so you can score as in the 4-point scale. Okay, athlete is unable to perform as a 1, to perform with the compensation 2, if it is performed completely correctly as a 4, so 3. Okay, as shoulder mobility stress, actually the measurement has been taken from the distal crease of your wrist, from your third digital finger. Okay, so this measurement has been taken. So this will measure, actually the athlete has to place his one hand with the external rotation, adduction. So other hand should be in the internal rotation. We can measure this length and we can compare it with this one, whether it has the same value or it's not able to achieve. So this will assess the shoulder mobility. Okay. And the fifth test is the active straight leg rising. Here, the measurement has been taken from your patella to actually the ASIs to your patella. The midpoint of your ASIs is actually the measurement from your ASIs to patella. In this midpoint, the dowel has been placed. Okay, and ask the athlete to rise his leg, straight leg rising. So if the athlete crosses the dowel, so the stick, we can give a 3 points. Okay, if this rod lies in between your ankle and knee, is 2. Sorry, it's actually this is only rising on 45 degree, and this line is lies in between your knee and hip. Is 1. Okay, so this tests the flexibility of your hamstring and gastrocnemius. There's a trunk and core stability. So here the athletes has to place the hands over actually the line of chin and has to do the push-ups with a stabilized core. This ability to stabilize the spine, anterior and posterior, sagittal plane during a closed chain upper body movement. Okay, so here the scoring system for male, the line of thumb, the thumb alignment is considered. Okay, the score 3 is for male, the thumb alignment would be placed forehead. For female, it would be chin. If it is a 2, the thumb alignment would be the chin for male, and the female, it should be over the clavicle. So actually, if you keep moving a hand down and down, it would be easier. The push-up would be easier. If you move a hand away from your chest, the push-up would be a tougher one. So that's why this system is a bit tougher. When it goes near to your forehead or chin, is a bit tougher one. And rotatory stability, actually you can quadruped position, you can test this one. So the trunk needs to be stabilized. Actually, if you check this one, okay, so many of the time your stabilizer, especially your oblique muscle, is not stabilizing your pelvis. So automatically the trunk would be rotated upward. Okay, so this needs to be the trunk needs to be on the line, and the shoulder should be on the line. So this tests your trunk stability during a combined action of your upper and lower body extremity movement. Okay. So these are all about the screening. Okay. Before proceeding with your functional training, this screening should be taken for athlete 7 screening tests. So now, how to recognize the functional exercise? How I can recognize this exercise is functional or this exercise is not functional? Okay. So many times I say it should be a sports activity the athlete perform. So however, we may add some point to that. The exercise must allow movement in multiple planes. Okay, in the functional strength training, functional exercises, the exercise should allow the movement in a multiple plane. This might be a TRIPLANAR. Okay, the exercise must require stability. As we talked about stability and mobility, the exercise must require stability through through one or more transit station, including, so transit station, as I told, some point, some part of the body should be stable while execute, other part execute the movement. Okay. And third one is the exercise must engage a kinetic chain that are used to swim or that's involved in the sports. The exercise should this is the main point. Okay, the third one is a very major point. As I said before, the exercise, the functional strength training, so functional exercises mean that the exercise should engage the kinetic chain. Whatever the kinetic chain the athlete use in sports should be used in the training model. So what are the main functions? Like, sorry, what are the main movements actually in functional movements is in sports as athletic movements and the lifting movements. Athletic movements usually the jumping, throwing, locomotion is just a movement, and the rotatory and the lifting movement are pushing, pulling. We know it's the pushing, pulling, hip hinge, and knee bend. So is the jumping we know, throwing we know, locomotion we know, rotation, pushing, pulling, everything we know. So what is the hip hinge and knee bend? Okay. So let's see what is hip hinge and knee bend. So this is the hinge, okay. So we have seen the squat, okay. We have seen the hinge is a little bit different from the squat. Usually the athlete prefer during the deadlift, the athlete prefer this position. So here, as I told before, the knee is dominant, and the squat, your knee is dominant than your hip, okay. But in the hinge, your hip is dominant. So let's see here, your hip is dominant than your knee. So this is the main part of your hip hinge is your back stabilized. So this position may not achievable easily. So the many of actually, if you ask somebody to say, especially back pain patient, if you ask to keep this position, definitely the back stabilizer is not going to stabilize the back. So here you may get a C curve, the kyphosis. Okay. So this hip hinge is actually, this is the main basically. So when they perform deadlift, squat, when they perform a deadlift, so if you lock an extension, so there is no chances of disc bulging, there is no chances of back pain or facial pathology or something else. So this hip hinge position is mainly for the weightlifter. So this is the difference between your squat and a knee. Actually, here you can see the weightlifter lifting on the squat, and the hip hinge is usually they prefer this position with a deadlift. Okay, so while lifting, so here your hip is dominant. Your hip is dominant than your knee, and the back is well stabilized. This is a hip hinge position. So what are the stages in developmental training? Actually, what are the stages are there in the strength training? We have three stages. So as I told you before, the training can't be very effective without having an optimal transfers. There should be a transfer. There should be a stage. Okay, the athlete needs to progress stage by stage. If they are if you're giving same type of training, so one day the athlete may get adapt. That will not going to help the athlete to progress himself. So the stages are three stages are there. One is general strength, okay, and the second one is the special strength, and the third one is the specific strength. And general strength, we have a traditional function strength exercise like a squat, deadlift, or lunges, whatever the traditionally we follow. Those things comes under the general strength, and the special strength closely resemble the target activity. So again, it's athletic performance, okay. So this closely resemble the athletic activity in sports. And the specific strength resisted drill. Actually, it's mainly for resisting the athletic activity with some resisted drill. We'll look into deep. Okay, these three things. Okay. So as I told, actually, is the steps. Okay, first is in general strength. We train the athlete in the first stage and second stage and third stage. Okay, on general stage, as I told, we have a traditional strength training like a squat, lunges, and special we have like a sports kind of activity. And the third one, specific strength, resisting drills. So actually, so this is what the training model. Okay, so the training differ from sports to sports, again according to the athletic need. So here I'm going to talk. Okay, so actually I'm taking two sports event. One is actually we divided this all sports event as a individual sports event, like a sprinting, cycling. Those things is the individual sports event. Okay, like a team sports, football, hockey, cricket. This is team sports. Okay, I'm going to deal with one example in your individual sports and one example in your team sports. The individual sports I'm going to talk about sprinting, and the team sports I'm going to talk about football. Okay. So in the sprinting performance, actually in the sprinting performance, how you enhance the sprinting performance with functional strength training. So actually in the three-way, so there are many ways out there, okay. But here I can take only the three of the training model. I'm going to deal with the three training model. If I give a large examples, actually you may get confused. So here I'm going to the training performance. Actually, I have taken three models to improve the training performance. The first one is, so should I have a knowledge about the mechanical determinant of sprinting performance? Okay, the first one, the training should be improved having a knowledge about mechanical determinants of sprinting. So what are the determinants in sprinting? How we are going to improve the determinants? Okay, the first one. And the second one is a functional movement correction on sprinting. How we can correct a functional movement. How while performing the sprinting, we can analyze the sprinting movements and how we are going to correct and how we are going to how make athlete to perform a little bit more than what they're performing normally. The second one. And third one is stages of development in training model. Actually, as we talked about the stages, how we are going to implement all the stages in the training. So this three-way, I'm going to deal with a sprinter and taking this three-way, how we can help the sprinter to improve its performance. So this is the phases of running. You can see the video. This is the acceleration phase, okay, and then this is transition phase and the maximum velocity, okay. The acceleration phase is the starting phase, and the transition phase is moving around once the athlete transition from the acceleration phase to transition, and is moves on to maximum velocity, okay. So this is sprinting position, starting position, okay, and the athlete kicks off back and he's hitting the ground, okay. He's hitting the ground. How much fast and how quick he hit the ground, that is the ground reaction force. Newton's third law, how much you are giving a force, you are getting a force, okay. So each and every force has an equal opposite reaction. So here the athlete hits the ground and is getting a force to move forward, okay. So that's the initial acceleration phase. Once it's moved to the transition and the maximum velocity, okay. So these are the phases of running. So I just take the evidence-based which support how to improve having the determinant, actually designing the determinant, how we can improve the athletic for the sprinting performance, okay. A study actually has been done, association of Prince performance with the ground reaction force during acceleration and maximum, you know what is the acceleration, and maximal speed phase in a single sprint, okay. In the study, what they have done is the 18 males has been assessed in the 100-meter, 60-meter sprints, okay. And the 18 athletes has been actually in this one. The average, someone has completed that 16-meter sprint with the 10.54. The maximum time they have taken is 12.30. And they assessed the ground reaction force with a 54 force platform. Actually, they have placed the 54 force platform to assess the ground reaction force. In this study, they have found the largest propulsive force during the entire acceleration phase, okay. The propulsive force is the moving, as I said, the athlete, how fast he is hitting the ground, okay. How quick he is hitting the ground, he may get a transition, actually he may get a force to move forward. So the largest propulsive force during the entire acceleration phase, okay, and suppressing a braking force, okay. Whatever actually moving, that should be some braking on our body due to gravity because of the body weight, okay. That things suppressing a braking force when approaching a maximal speed. When actually how the athlete should know how to suppress the braking force when approaching a maximal speed. That is the second point, okay. And the third point, larger vertical force during the maximal speed, okay. The larger vertical force, actually I show the video 1 second, okay. So first thing, actually just remember the larger propulsive force during the entire acceleration phase. While the acceleration, the athlete need as the propulsive force is nothing but a horizontal force, okay. The athlete moves in the horizontal force, using the horizontal force. Once it's coming to the maximum velocity, he's using a vertical force, okay. So just to go back and see the slide, first slide, okay. So it's not playing. Let's move back. Okay. So here you can see, actually here the athlete made his body in an inclined position. See here. So when it's completing, it's completely vertical. Okay. So here is need a propulsion. Okay. He has to propel the body over the ground. So the athlete should be completely take a horizontal position. So he hit the ground, getting back this action, and then moving forward. So while initially the acceleration phase. So most of the acceleration is because of the horizontal phase. Horizontal propulsive force. And when completing, you see the athletic action. He's jump actually once it started to uses actually the starting position. Maybe his body is in horizontal, but once it reaches the maximum velocity, is completely vertical. His action will be a little bit jumping action to reduce the braking force. Okay. So this is the graph shows so individual athlete stride length. Okay, this is the individual athlete stride length. The first one you see actually it starts. Okay, the athlete starts here. It takes first step, second step, third step, and is completed with 28 strides. Okay. So initially you see the stride length is this little. This shows the stride length between the stride length. So initially he has a long strides. Okay, it's long strides, and is move forward. The stride length automatically decreases when it's completing as almost because he has a jumping action. Is reduces his propulsive force is more. He create the momentum, and that momentum will propel the athlete faster and faster and faster. And this vertical force here is completely horizontal force. The starting in the beginning stage, the athlete doesn't need a horizontal, completely horizontal force. Once it goes fast and fast and fast, and its reach here is completely a vertical force. You can see the peak here is this stride length is maximally horizontal force. Here the peak is the vertical force given by the athlete. So why we have to analyze this one? Why I need to know all this one? Okay. So actually, as I told, the two forces, one is the horizontal one, another one is the vertical one. You may assist the athletes. Okay. If they have actually, you can divide it as a two part: the acceleration and the maximum. The phases of running. So you can find that the athlete is lacking. Okay. So whether he is lacking in the acceleration phase, whether he's lacking in the maximum speed. Okay. So where he is lacking, you can assess the athlete. So if he is lacking in the acceleration, you can train the horizontal oriented exercises. Okay. As I told you, the acceleration need more horizontal forces. The athlete is lacking in the horizontal acceleration. You can train a sprinter horizontal oriented exercises. If he is losing on the maximum, the acceleration phase, once his transition phase is losing in the transition phase, you can train him with the vertical oriented exercises. And the third one is reducing basic braking force is mostly a skill oriented, as can be attainable with athletes' own experience. Okay, the braking, how to reduce my braking forces can be achievable with more athlete. But if you train these two, automatically the athlete is more familiar with how I may reduce with my braking forces. Okay. So just see the video. Here, actually, the two things. Actually, here one video is a video of athlete. I just the black one is the video of the Don is the video of athlete. He's an athlete, and the David is non-athlete. The athlete is compared to the non-athlete. Okay, here the athlete is compared to the non-athlete, and we look functional corrections. Okay, so where the non-athlete is lacking in his function. So if you see this one again, so he's an athlete, he is a non-athlete. Okay, so see his knee action, so how his cycle, and the ground reaction force of athlete is almost 700 pounds, and non-athlete is 500 pounds. How it's achievable? Flexion. Okay, here I repeat once again. Just watch the knee flexion while swing phase. between athlete and non-athlete? This one is athlete and this one is non-athlete. The ground reaction force, what they have given is only 500 lbs, and here the 700 lbs. The next slide, you can watch the knee flexion. Okay, here the completely controlled knee flexion. Here doesn't, the knee flexion is not controlled. Okay, so this one is after training. Okay, so after, if you control the knee flexion in a proper way, this is the non-athlete ground reaction force, and here the post reaction ground reaction force. And the pre one is almost he achieved in the 400 ways after he has been technically corrected. Okay, as a functional technically corrected. After his correction, and the ground reaction force is almost 600. Okay, so how this functional training can be, actually I told, so actually I said before itself, when we train the hamstring, there is a teaching hamstring, there's lunges with teaching the hamstring to extend the hip while controlling the knee flexion. Look here. Okay, so the running position, okay, the athletic position is extending hip while the controlling, that the lack of training. Okay, so as I told, there's the comparison between the athlete and non-athlete, where the non-athlete is lacking the controlling the knee flexion while extending the hip. Okay, while extending the hip. So this lunges will train your hamstring to control while control your knee flexion while controlling your hip extension. Okay, so that's the thing of training, that's the thing of functional training. This is almost the same function of athlete. So before, you may not notice what is the use of lunges, so why it needs to be trained. Okay, so you can see the resemblance of the same action while performing a sprint and while performing the training. Okay, this not can be achievable with any missions. Okay, so whatever the missions you have, this is high-fi missions, whatever it is, and this can be achievable through only function. So this is what the second phase is, the technical correction. First one is the correcting the determinants, and so knowing about the knowledge about the determinant, how the phases are working, actually which are the forcing acting on the initial phases, and the later phase which are the forcing first we have seen. And the second one is, this is the functional technical correction. We are assessing the movement pattern, so we can correct so functionally, and we can train it in our training room, and that can be implemented during the athletic performance. And this will give an example how they have developed after the training. Actually, we have talked about the three stages: general strength and specific strength. Actually, so now we are going to train athlete with all three stages. Okay, the general strength, usually we have a traditional strength training like a squat, something. The squat, actually, the athlete may perform a squat very well. Actually, if it's a beginner or you are training so beginning athlete, elite athlete is okay. So if you're training a beginner athlete, so the squat is a little bit harder. So you can't give a squat directly. So instead of asking squat beginning, so you can suggest the wall squat. Okay, so wall squat is the back is straight and the knee is in right angle. The foot is placed with the line of your thigh. So this one, and you have encouraged the athlete to tuck his abdomen to engage his core. Engage your core. This will help to maintain. Okay, this will help to maintain the position of this one. Okay, and once he's achieved this position, you can train with the ball. Okay, so this ball as a dynamic. This is a static squat. It's asking the athlete to stay in a stable position, and this is dynamic one. You can support with the stability ball, asking athlete move up and down. This is also a little bit higher than this level. And the individual squat, okay, so the static squat never engages your glute. The static squat never, the glute action is almost none. There may be a minimal action, it's a glute action. So only the quad works more on your static squat. But in this dynamic squat, you are engaging your glute and your quad both. So you can progress the squat from wall squat as a stability ball squat, and so you are bringing to the normal squat. Once you taken to the normal squat, then you can load the squat. Okay, the barbell squat or tumble one, you can ask the athlete to use the tumbles or use the barbell squat. you can promote a little bit external weights. Okay, this is only by body weight. Usually the training should be combined with athlete own body weight. Once he has been stable, once the stability and mobility has been achieved properly, then he or she has been promoted to external weight. External weight, you can use dumbbells, you can use barbells, okay, and you can use, the next one is the plyometric actions, okay. So you can add a squat along with your jumps. So this will give a larger propulsive force, okay. So for example, a squat after jump, as a jump is after squat. So stepping over the squat and getting down from getting down again, making a squat. This need a larger coordination and a bursting activity of your glute and quadriceps, okay. So these all in the general strength, how you train a squat, okay. So this next exercise, we can take it as a lunges, how you train lunges in the general strength. This is general strength, actually how you train lunges. So you can reach overhead lunges and forward reach and the stepper. Actually, usually lunges without weight, actually initially, as I told you in the squat, without weight or the own body weight can be used. Once the athlete has been progressed further, you can ask them to hold the medicine ball. You can ask them to hold something weights like dumbbells. Those things can be added. So overhead actually asks the athlete to reach forward. Twist can be played and forward reach, and you can make the athlete to over steps to increase the quad stretch. So the first stages as general strength is over. Then coming to the special strength. Okay, special strength is something resemblance to the sports activity. So what we have seen, the second stage strength is something resemblant to the sports activity. As I told, the single leg balance is very key point of this many athletes. Okay, so for example, if you're kicking your football, so you have to stay in a single leg for this is a microseconds. Okay, so the single leg balance is very important. It's sport specific. So those things in this training, the single leg squat, forward single leg forward reach, the single leg stability ball over the stability ball, hip extension. So this may train your glute and hamstring. So these can be added. These type of exercises. Actually, these are the not only these exercises. We have so many exercises. Just I have given the example to make you understand what the stage represents. Okay. So initially we have seen the general strength. Now we see what are the exercises can be added in the special strength. Not only these exercises, you have many exercises you can add it. So many exercises like this. This is especially the sports specific exercises should be added on the special strength. Then next, promoting to the specific strength. Here actually I saw resisted drill. Okay, for a sprinter, what would be the resistor? You can use the TheraBand and you can use a sled sprinting. So these all can be resisted. Okay, so how the resistance training going to help the athletes? So usually the weight sled is a recent trend. Actually, the weight sled has this more focus on the weight sled because it has so many articles supporting the weight sled is supporting as a weightless is a good supporter for acceleration to increase the speed in the acceleration phase. Okay, so let's see how it's helpful for the acceleration phase. So as I told, that actually we know the phases of running. The acceleration phase is the main thing for to get a propulsion. The key is determining the acceleration force, the ability to generate a larger magnitude of ground reaction force. As we've seen that, what are the key to increase your acceleration? The ability to generate a larger magnitude of ground reaction forces. That's in the horizontal direction. Okay, there's always acceleration things of horizontal direction. Okay, the resisted sled training provides a specific means of providing overload in the horizontal direction. Actually, I have a video. So once you see the video, you may get to know how it's giving a resistance in the horizontal way. Okay, so the resisted sled training provides a specific means of providing overload by horizontal force that will increase the acceleration. What we have seen before. Okay, and the training stimulus is depend mainly on weight of sleds. Okay, the training stimulus is the stimulus is mainly depend the weight of sled and the coefficient of sliding friction. So which surface is friction he is using, whether he is using on the field or whether he is using on the weight room. The surface is mainly the coefficient. Okay, the training stimulus is always different. What the weight the athlete is using for weight sled, and the training surface also play a role. And here, so what the load I can give for the athlete. Okay, So I can use 10 kg or 20 kg, doesn't like that, okay. So actually you ask the athlete to perform, reach, okay, so it's 10 meter or 100 meter activity. So ask the athlete to perform first initially. So you may know the time, what he reached in the 100 meters time, you may know, okay. The weight should not decrease the athlete perform more than 10%. Okay, the weight sled training should not decrease when it's, if you are giving a training for an athlete, so you know the how maximum speed of the athlete, okay. So you know the maximum speed. So if you add the weight sled to the athlete, that training will not reduce the speed of athlete to more than 10%. So there you can decide your weight sled load. So how is going to improve the running? This is improve the effective force application. So actually, I show the video. You'll remember how is it. I'll just explain, and then I'll go to the video. The effective force application is giving a determinant of sprinting is the velocity-oriented force velocity. Okay, this resistance is going to be applied in stance phase during the swing phase. Both phases are resisted with resistance band and sled training. Okay. So you may have only a stand phase, you may have a resistance, not like that. Okay, the both phases, both in swing phases and stand phases are trained. Okay, and achieve as orient force horizontally during acceleration. Is achieve aggressive posture of the body while training athlete and with weight sled. Athlete may have a posture, aggressive posture and body angles. This can be transferable again. This can be transferable during the post performance. Okay, during the weight sled training, the athlete have aggressive posture and body angles. This body angle and aggressive posture can be transferable to sports performance. The high step frequency, usually we have a fear of falling. When we incline, we make a body incline horizontal position. So usually the athlete may have, actually I may fall forward, okay. That fear of falling would be that during the acceleration phase. When you train with training, it will reduce the fear of falling. So the athlete may not having the fear of falling when acceleration phase. And the last point is the train viewed in sprint specific manner. As I told you, this training, actually the late swing and stance phase can be trainable through resistance and weight sled training. So this can be achievable through weight sled training. So I have a video, just check this one, okay? So this is without resistance. The athlete is performing the sprint action without resistance.
There is a function.
Oh. See her action without, again I'm repeating. So this is the horizontal position, he is performing the sprinting action. So he is not going to incline, okay. His body is actually, see, look this too, okay. So which one is more inclined? I repeat again, compare this to the body by body position. I have not given any instruction, okay. Let's say automatically the body goes inclined position, our legs is pushing back, okay. So automatically you are increasing your horizontal force of an athlete. So when you give some resistance over, at the same time, the athlete may not have a fear of falling when accelerate. So that's the main thing of resistance training. So this is all about how we can improve a sprinter performance. And the second one is, as I told, as a team performance in the football. Okay. So the second thing, just to discuss simple exercise, how can we can train team sports athlete with functional training. So as I told you, this team sport athlete as a single leg exercises, a single leg stability is more required, because many of the sports require a single leg stability. So here, the more focusing during running and jumping activities needs to be get added in the functional strength training. So we have a component in sports. Okay, for example, sprinting is one of the component. Vertical jump is one of the component. The agility is one of the component. So we have, so we can divide this component and we can train each component and we can get improved. Okay, we can progress the athlete in these components is going to be influence on sports performance. Okay, so I say if you have a good sprinting capability, if you have good vertical jump capability, if you have a good agility, so this will reflect on your sports. So, so you may ask, okay, so you may ask, if I have all this capability, can I perform well? Okay, so this can be trained by trainer or physiotherapist, but the transition of this effort going to be given by us as this to the sports performance athlete. Okay, we have an article saying that this capability will directly influence the sports performance, but however, athlete individual, how they are going to transfer this effort to the sports is again is depend on athletic capability. So, okay, so the training we can provide. So, but transferring the effort is completely by athlete. Okay, the sprinting again, I say, is actually resistance sprints can be used, and the vertical jump you can use a plyometric box, medicine box, actually those things. And the TheraBand also you can resist vertical jump by TheraBand. So again, the agility training you can resist with banding exercises. So you can train in this way. Actually, I don't have much video because of this lockdown. So actually, I have chosen something. Actually, this can be done in this way. So you can improve the sprinting and vertical jump agility. So this skill is going to directly influence on your sports performance. So agility training. The simple agility training. We have so many shuttles with the cones. Okay, so this is simple agility. So how far he is changing back with control. As basically he says is how is stable. This is completely an agility training. Okay. So that's all about the functional strength training. So now we move back to we move to the neural component of flexibility. So when I say flexibility, you may know the stretching is main to improve the flexibility. So stretching is mainly performed by every athlete to warm up and warm down periods. Okay. So here the neural component of flexibility says stretching your muscle is not only going to affect. Okay. So not only is this enough action. So because the thing is, your muscle is not only a limiting factor of your joint movement. Okay, your facial tissues and your neural tissues also play a role of your flexibility. Okay, so for example, if you take actually hamstring flexibility, I have not gone through so many muscles. I'm dealing with many muscles. I'm just going to deal with some slides, only 2 or 3 slides or more now. I'm just going to deal with your hamstring flexibility. Because the hamstring flexibility, actually study says the hamstring flexibility is a key factor for many injuries. Once you improve the hamstring flexibility, that would be as a fine and good for athlete to prevent injuries. Okay. So usually in hamstring, so hamstring stretching, so we prefer to modify our athlete position. So but here actually what we say is we can add an active knee extension, the neural stem position. This will stretch your hamstring as well as your neural tissues and your facial tissues. This is not a elastic stretching, okay? This is an active knee extension. It means that in the position, the athlete may ask to perform the active knee extension at least 30 times, okay? So automatically his stretching is hamstring along with his neural tissues. See the spinal cord and the fascia. The fascia has stretched in this position. Oh, this may help the athlete to maintain the flexibility for the long time. So who all needs to be trained in this one? Okay, the measurement has been taken with the active knee extension test. Okay, here the athlete hip is stabilized at 90 degree. Ask the athlete to actively extend his knee, and the ankle between the imaginary line and the limb has been taken. If it is more than 15 degree, we have decided we can decide this angle. If it is more than 15 degree, we can decide the athletes or hamstring tightness. They needs to be strengthen. They need to be stretched with hamstring. That's the neural stretch position. So that's all about the flexibility. So here I can show some photos of my training, football training. So he is a Smithra. She is a Smithra. He has two ACL two ACL surgery. After his second surgery, he was rehabilitated almost 4 to 6 months. 4 to 6 months. After her rehabilitation, he played 11 international games. Okay, 11 international games, almost 11 international tournament, almost 31 matches. Actually, I just asked to take some photos on field. See the squat of her. Okay, how stable it is. It's not. It's almostly a perfect like non-surgical athlete. Okay, the squat is perfectly okay and balanced. And C is vertical jump. As I told, the vertical jump is one of the component of sports. Okay, so C is vertical jump during heading. So how far is jump without a fear of falling? Okay. So the model actually, what I've helped her in the model like is Sandhya. They are South Asian game. They are the gold medals in 2019. So these two are the Sandhya and Smithra. So he is the ACL rehabilitation girl. And these two are from our district. Actually, I'm happy to say they are the champion in South Asian game in 2019. And actually, I have a chance to train these two people in under my supervision. So this is ACL rehabilitation, and he is getting a regular training. In 2016, SSA champions. They got SSA champion. Almost actually they have participated in women leagues also. They represent India. Actually, the two of from Karloor district, they represent the Indian team in the South Asian game. So finally, okay, so we learned functional movement training and neural component. Okay, so how I'm going to implement. So whatever what we learned, we should have an implication in our practice. Okay, so how I am going to practice? I'm increasing practice. If any sprinters, okay, so you may not remember all the points, okay, but if any sprinter coming to you and asking, so if he is asking about the training, so you may know the phases of acceleration, you may know the 4 phases of transition. So you definitely you may remember that the horizontal forces are required to increase the acceleration and vertical forces are required to increase the transition phase. So these things you are going to apply with the exercise, the sample exercise what I've shown here. So this is going to be applicable in your practice. At the same time, we have seen the principles also. And the principles, you may keep athlete regularly watching, and the type of exercise needs to be changed. If you're giving same type of exercise, again, it's going to be giving adaptation. So you train the athlete with various type of exercises. You're not going to train as athlete in the same exercises. And while stretching the athlete, as you are not going to follow the regular stretching pattern, you may include your neural component along with your facial component while stretching. So this is all the clinical implication. And that's all. Thank you so much for this opportunity. Thank you all. Thank you all being there with me. Thank you.
Thank you, sir. Thank you so much. It was really a very good session, sir. And we will go for a doubt session. Yes, sir. Yes, sir. You have explained stepwise actually, and really on the video also worked very nicely. It was really a good.
Exactly. For video, actually, I have to thank two people. So one is Dr. Ramesh, who's working in Karloor GH, and second one is Dr. Saran, who helped me because yesterday's session actually it's gone because of network problem.
Network issues. Yes.
Network problem. Actually, we just made an arrangement today, so the session could go without any interruption. So I would thank both of them, and I would thank my team, Dr. Shankaran Varlur, and my all physiotherapists who helped me for this. And as the team I trained, especially, they helped me a lot.
Okay, sir. Okay, sir. I too thank them, sir, for their help.
Thank you, sir.
There are some questions, sir. We will take.
Yeah, can I read or
yes, yes. You read it, Rupesh.
Yes, sir. First question is from Physioria. Sir, please explain difference between progression and overload training principles, sir.
So overload is nothing but the load you are going to apply. So this is, for example, if I say strength training, you may easily get, okay. So overload, if I'm doing a 5 kg for 3 weeks, 3 weeks, and the next week I may progress myself, so I can overload myself with 6 to 7 kg. So overload is the load you are applying to the muscle, as the load applying to the muscle or the athlete. That's the overload. But the progression, you can't apply overload immediately by day. So now 5 kg, next day 6 kg, not 7 kg. This is the progression should be slowly and gradually. So you have to wait for the time for the adaptation. Once the muscle is getting adapted, and you can go the next weight, and you can progress to next weight. So afterwards, okay, because once you give a load, once you're training, the muscle is getting micro tears, okay. The micro tears. If I load 5 kg, okay, the muscle is actually get teared, and it will restructure itself. It will restructure itself, and what the way it's restructured, if I load 5 kg, it should not again get injured. The muscle is getting restructured. If I load up for the 5 kg, okay, if it is restructured and if it is working, it's adapted for 5 kg. So then next load comes, okay, 6 kg, 7 kg, 10 kg, whatever it is. So that's the overload. But the progression is slowly, gradually. You can't overload. You can't give a weight rise immediately day by day. The progression and there should be periodical. So you take a time for adaptability. The time is nothing but a progression.
Fine, sir. Next question is also from her. How can we train for reaction time?
So the reaction time is completely it's also an athletic capability. So for example, sports specific skills. Okay. So usually we train. We ask the athlete to focus the ball. Okay. So for example, the reaction time. One of the one of the exercises. We ask the athlete to facing the ball. We stand on the back. Okay. We throw a tennis ball, so keep throwing a tennis ball. Okay, he is not seeing my throw. Okay, because I'm standing behind her or he. So he is focusing the ball and immediately react and catch the ball. So in different way. Okay, so wherever I throw, he's move forward, backward, sideways. Okay, so he react fast. Okay, if I see if he or she see my throw, he may know that where I'm going to throw. But if or she is focusing the ball, so he doesn't know my angulation or my hand position, so he has to react fastly according to catch the ball. So this is one of the example. Actually, we have many exercises.
Fine, sir. Next one is from Manveer Kaur. Sir, please explain set principle again.
Set principle is nothing but as what you train, you get what you train. If I say simply, if going to the restaurant, if you order for masala dosa, you'll get masala dosa. Okay, so the training is, if you train endurance exercises, you definitely the athlete endurance is going to be increased. If you train for strength, definitely is going to be the athlete strength going to be increased.
Fine, sir. Next one is from Miss Rukmani. How is functional training applied on an archery sportsman?
So archery sportsman, actually, I'll say that actually these are the component I said already. So the technical corrections, knowing the determinant, okay, how you should know the determinant of archeries, you should know the technical correction, you have to analyze the archery positions, and you have 3 stages again. So especially for archery, so you have to core and the shoulder muscles and the focus. Again, those are the reaction times, those things comes into point. So these 3 stages, you can the sport specific actions can be included in these 3 stages, and you can progress slowly.
Fine, sir. Next one is from Mr. Satish. Sportsperson, how do improve and maintain in cardiac function?
So cardiac function is completely a cardiac exercise. This is a completely aerobic exercise. The cardiac function is. So the aerobic activity, so whatever activity you're doing, so high HI, we say HIIT, so high intensity interval training. The aerobic activities like running, swimming, cycling, all these things can be improved by can improve your cardiac endurance.
Fine, sir. Next one is also again from Physioria. Sir, please suggest equipment with base down for stability.
Sorry, I'm not getting.
Equipment based on stability. Any equipment do you suggest?
You can unmute her and Make her to talk.
Yes, sir. Ria. You can unmute
Actually,
yourself, Ria. You can speak out.
Yes, sir. Sir,
yes.
I want to ask, as you suggested that we should train on the equipment which has a triangle base downwards, right? That's the appropriate way.
Sorry,
Did you
again,
get it?
I'm not getting. You're asking equipment for training, is it right?
Yes, sir.
Stability.
Actually, as you teached just now, that we should train on such a device that it should have has a base, broad base in the downward, right? And athlete should be on the
No,
narrow
actually,
space,
I'm not
right?
saying this is the broad should be there. Actually, you're speaking about the triangle. What I mentioned because I think
Yeah,
am I
yeah,
right?
yeah.
That's okay. Actually, that concept I actually want to imply. I want to say that the athlete needs to be trained in a stable base. It's not. I'm saying the wider one. Okay. So, for example, you may have seen a balancing board. Have you seen the balancing board?
Yes, sir. Can we train on the balance cushion? It will be stable little bit as compared to that.
No, actually, you can
Balance.
progress. Actually, I think this is a concept, just concept. Actually, I'm not speaking of any equipment in that. Okay, I'm just speaking about your stable surface and non-stable surface. For example, stable surface, we can take it as a ground. For unstable surface,
Okay, fine.
we can take it as a balancing board. Okay, so stable surface where
Yeah.
actually the athlete which give more benefits. Okay, whether the stable surface give more benefits or whether unstable give. Whether if you train an athlete in a stable surface, it will give a more effect. If you train unstable surface, it will give a more effect. Actually, I want to say that.
Okay.
So the stable surface, if you train on the stable surface, that's the base place triangle. Okay, if you train on the stable surface, that girl, if you load athlete, or so whatever loading, you are asking the athlete to squat and you are asking the athlete to use a medicine ball. If you give a stable surface for athlete, that would be more benefits for athlete instead of giving load to unstable surface. So
I got it, sir.
I'm not talking about any equipment there. I'm just talking about the surface where athlete needs to be trained.
Okay. Thank you so much, sir. Very well
Thank you.
explained, sir.
Thank you. Thank you.
Yes, sir. Next one is from Mr. Mohammed. Can you explain what is the position of leg during squatting?
So shall I go with the slide again?
Yeah, sir. You
Sure.
can.
Thank you.
Duna madam, please do allow screen share.
Yeah. He's
Allowed, sir.
Is it visible?
not yet started,
Share
sir.
your screen, sir.
So once again. Is it visible now?
Sir,
Sir, visible, the last slide.
Last slide visible. Okay, once again.
you're disconnected, I think.
No, sir. Actually, I'm on the line. So just I'm taking the slide which I need. So can you see now, sir?
Yes, sir.
Okay. The
Deep
squat
squat.
position. On the squat position, the main thing is squat. The knee should not precede your the foot line. Okay, this is the foot line. Okay, here you see the knee. The knee is back of your feet. Okay, just as back of your feet. It should not go forward. If you ask, actually, I don't have a abnormal squat. Okay, if you ask this who doesn't know the squat, usually the knees goes down like this. Okay, it's lead forward your foot line. So that's increase load on your quad, and it will give irritation over over your patella. Lead a patellofemoral arthritis. Okay, if you squat and if the knees goes forward than your feet line. Okay, so the first thing is and the knee should be back of your feet line. And second one is the heel should not be raised. The foot should be completely placed. So you may go with wider squat, no problem. So you can keep your foot a little bit wider, it's not a problem. So the wider squat is easier than the narrow squat. So the wider squat is a little bit easier. So initially, if you want to train, you can train with the wider squat, and you can make it narrow over your hip line. So that would be the ideal squat. And the second one is, as the squat is, again, I say, is a knee dominant position. The hip should below your knee. The hip should goes below your knee. So if it is higher than your knee, it's not a proper squat. It should below your knee, and the shoulder and the back should be straightened. Okay, somebody who doesn't know squat, they should lean forward. They should lean forward. They strain them lower back. So once they lean forward, definitely the lower disc may get a problem. So the squat should be this squat, the line of the spine should be stable, and that will allow a glute load. And if I ask with standard squat with stick, this stick will not go as over your feet line. It should be a back of your feet line. So this is the line, and the rod should be back of your feet line.
Yes, sir. Next one is from Mr. Aravindan. Does knee valgus affect sports performance? If it happens, how can we correct it?
Definitely, the knee valgus will affect the sport performance. Okay, so again, the knee valgus. So you can go with a strengthening program, but the percentage of knee valgus again is a matter. So how much is knee valgus? The percentage of knee valgus again this is depend on the percentage of knee valgus. So usually, if it is the bony valgus, so usually so correction is a little bit harder because already the bone has been in a valgus position. So correction is a bit harder. So if it is mobile, as it's due to the muscular imbalance, you can have a strengthening program like a quad and TFL. So those things in the hip abductor. So those things, if you strength, if it is a mobile, definitely it can be corrected with a strengthening program.
Fine, sir. Next one is from Aswina D'Souza. Will there be a difference while training in different altitude?
Definitely, the altitude, because the athletes are training at a different level, because the oxygen the availability is definitely differ. Okay, so we have a various models. As athlete, as altitude as a plays main role. Even if you says actually one of the same both says in his quote. Actually, I'm not trained with any gym. Actually, I run with the mountain. Actually, wherever I feel I run and I run back. Okay, so the altitude will give a different atmosphere for an athlete. And the climate, actually the climate is also winter seasons also needs to be trained differently, and as well as the altitude also has a different training model.
Fine, sir. Few appreciations in between. And next one is from Ms. Shahida. Sir, can you explain about stability versus balance?
Stability, actually, so balance is actually simply say stability. Stability is a higher force involvement. Okay, so for example, we can take it throw. So when you throw, your body should be stable, because one of your part of the body is going to execute a force. So this force can be resisted, and your body should be in a stable position to resist the force. Then only the force execution would be a proper way. If it is a loop, for example, balancing losing, if you lose your balance and you correct, so suppose you may balance when you coming to the balance. When you lose a balance, actually you may try to make yourself balance, and you are correcting your equilibrium, and you are trying to balance yourself, and you are getting back to the normal position. When you're acting with the minimal forces, balance. Okay, so when it's as the force is acting a larger part, and if it is controlled by your body, as a stability.
Fine, sir. Next one is from Ms. Rukmani. Sir, perturbations given on balance board will help in both stability and balance, as it includes both components.
Definitely, because perturbation training is almost included balance and stability, especially proprioception is included when you train on the balancing board. So these things can be applicable while rehabilitation. The part of rehabilitation, you can use it more. As I told you, when giving a load or giving a very powerful training. So training on the wobble board and training on the stability ball, definitely going to not going to reduce. Actually, the training which is on the stable surface is more value than training on the unstable surface. But in the point of proprioception and balance, you can train during the rehabilitation time. So suppose the ACL rehabilitation, followed by the ACL rehabilitation, you can train athlete in a wobble board, you can train athlete in a stability board. That doesn't matter. That would be the highly athlete proprioception.
Fine. The next one is again from Physioria. Some people have retroverted femur, not able to place feet neutrally. They keep toe out. Is it okay to perform squat in that position?
So definitely, actually, if it is any compensation activity, the compensation activity, first the analyzing observation, okay, as you told the retroversion femur, okay. So the analyze, if you assess the squat and you may know which is not allowing, maybe a stiff back or what to say is the knee pain. So whatever it is, which is not allowing us to a proper squat, which structure is not allowing a proper squat, we can identify through assessment, and that can be maybe treated or maybe stretched, which is a tightened structure can be stretched, and which is something is a muscular imbalance. We can give balancing exercises, and we can progress from one stage to another. Actually, I've given the various stages of squat, so we can gradually progress from one stages to the stages of squatters. Okay, so instead of loading immediately, giving a loading to a person external load. So you can usually supported squat. From that, you can add a body weight squat, and you can go with a second. So meantime, you can correct the compensation activity with your exercises.
Fine. The next one is from Miss Prachi. Can correct the knee varus in athletes?
So again, I said it's the percentage of varus, okay, how severe it is. If it is a bony corrections, actually it's not be correctable with exercises.
Fine, sir. And next question is from our YouTube viewers. One second. From Johar Maina. Sir, what are the precautions to be taken when the athlete is having some cardiovascular compromise? How my strategy or protocol changes?
Can you repeat the question?
If an athlete is having cardiovascular compromises, how a protocol or prescription might change?
So I'm not getting what is mean by compromises. Okay, actually,
Any
so,
changes in their heart functions, I guess, sir.
um,
For example, tachycardia or tachypnea, something.
So actually, so you have to assess the athlete. So during the training, okay, the heart rate, you have a training models. Okay, so the athlete needs to be trained at maximal level. We have a training. So initially, we start training at 60 to 70%, then proceed with 80%. Then athlete needs to be trained at 90%. So during the training session, you may have assessing her vital function. So according to the vital function, you can reduce the athlete intensity. So actually, if you mentioned if it is a tachycardia, so the training needs not be maybe symptoms may have. So usually not only the tachycardia, usually the calf pain, chest pain. Actually, those things, the symptoms will help you to identify the vital problem. So the meantime, you can stop the training, or you can reduce the intensity of the training according to the athlete need. So usually the intensity is usually we decide with targeted heart rate. That's I say is 60 to 70 to 80%. If you go progressively, if doesn't have any complications, if the athlete doesn't have any any problem in his systemic problem, so definitely you can proceed with a normal training model, that is heart rate training model with submaximal level.
Fine. The next one is from Ms. Sumitra. Whether road endurance training is good? If it is good, how good for ACL injured players?
Again, the road endurance training is okay, but actually the athlete needs to be trained in a different atmosphere. Actually, if he is in a sports person, so not only the road training, actually the different surface that must so atmosphere. For example, the incline or the decline, or something else, shufflings, turnings, twists, because only the road training means, actually I don't know whether it's only he's mentioning jogging or something else is shuffling, so those shuttling, those activities. Okay, so jogging will not only going to again improve the athletic function, as I told. It needs to be added the component of the sports things in athletic training. So maybe road training also a part of training, but it's not only a complete training.
Fine, sir. Next one is from Miss Prachi. How should we manage when upper body goes to more forward during squatting?
Can you repeat the question? Upper body goes more
Forward.
Okay. So forward, yes, absolutely. Because if it is go forward, actually the glute is not ready to take the load. One thing. The second thing is paraspinal muscles may be tightened as they have not squatted before. So the lack of flexibility. So the one thing is actually you have to stretch glute, and you have to stretch your paraspinal musculature. And again, I say that actually you can train by stages wise. Okay, supported and body weight and external weight.
Fine, sir. And we'll go with one last question from Satish. He asked something. I'm not able to get it. I'm unmuting him. Satish, you can unmute yourself. You can ask Satish.
Sir, athlete person is age in trotting, sir. So squat's position in the knee flexion is a crepited sound produced. How to treatments?
Sorry, can you repeat it one?
The athlete person is a school is at age is 20, sir.
Age is 20.
20, yes, sir. Squat's
Okay.
position knee flexion and knee produce the crepited sound. How to treatments, sir?
Squat position.
A knee
Knee
flexion.
produces crepitus sound.
Crepitus
Yes,
sounds.
Yes, sir.
Okay, so the crepitus sounds against the muscular imbalance. Actually, maybe the quad and hamstring may have, actually the ratio between the quad and the hamstring between is not this one. Some muscular tightness may be there. If you check quad flexibility and gluteus flexibility and hamstring flexibility, if everything is flexible, if it is maybe a tightness present, you can stretch the muscles, especially TFL. The TFL tightness may rotate the leg laterally. So rotate the femur laterally. So rotate the tibia laterally. So check for TFL and check for quadriceps flexibility, and especially the hamstring one. These muscles are well balanced, and the crepitus may come down.
You got the answer?
He is muted, sir.
Okay.
It was clear only, sir.
Okay. Any other questions, Rupesh?
No, sir. No more, sir.
Okay. Stop screen sharing. Can we conclude now?
Yes, sir.
Okay. Sir, very thank you, sir, because yesterday we cancelled and today you have done a lot of things for us. Actually, you really went to some place where you get proper network connection, and I thank Ramesh sir also, and I thank Mouna Krishnan sir especially because he told me, he guided me to approach you. So I thank Mouna Krishnan sir, and I thank all the participants who is having patience, and till the end they were listening, and the questions were awesome. And I thank my team members, Dr. Rupesh and Professor Duna, for a wonderful session, helping yesterday also. They were also tensed yesterday. So today it was so cool, fine, everything is fine. And I thank you very much, sir. I thank all the participants once again. I thank you, my team members once again. Bye-bye. Good night.